Y'all. Okay, cool. So here we are. Um, and this is our info session on the Pilates Anatomy School, Anatomy of Pilates course offering. So if it's cool with you, Cheryl, I'm just gonna like run through kind of what I have, like course outline,
Yep.
course dates, that kind of stuff. And then
Yep.
I'm going to try to answer some of the questions that came through email, and then you can ask any questions along the way. Like, feel free to interrupt me and, do
Okay.
that.
Yep. That sounds
Okay,
good.
cool. So, so the idea behind the Anatomy of Pilates course is that it is for already certified Pilates instructors. But I'm not like, you don't have to, like show me a certification or anything like that. There's no like, it's just like, are you teaching Pilates and do you want to know more about anatomy and rehab? Mostly because these are the majority of our clients. One, not necessarily anatomy, but I think that a knowledge of anatomy is really important and can help you bring value to your client in a way that makes you look like more of an expert. It makes you more of an expert. It makes you more of a problem solver. There's some really like basic ways that we can think about anatomy that don't have anything to do with like memorizing like the nerve pathways and what innervates where. And we can go there if people want to, but that's not really what this course is about. This course is more about like, okay, let's learn the general anatomy. Let's learn how muscles contract. Let's learn or look at pictures of muscles and be like, oh, it starts here, it ends here. What happens if that space gets shorter? What action does that have on the joint that we're talking about, right? So it's not super complex anatomy. It's not memorizing a ton of stuff. It's more like, okay, this is the picture of the body. This is how a muscle works. Now, can I look at this muscle and figure out what it does? So it's more an application of critical thinking rather than memorization. Because I have to look this stuff up still. Like, I don't have all this stuff memorized. And I don't see a lot of value in just memorizing a bunch of shit and then not really understanding how it works. So we're going to really focus on understanding how it works and focus on just the act of critical thinking about the body and about research. So a really big component of this course is basically learning how to read research, because the idea is that you come out of this course feeling a sense of autonomy in like, oh, somebody came into my studio with this condition. I have no idea what that is. I'm going to go look it up and I'm going to see if there's any clinical guidelines for this condition, or, what does the literature say about this condition or this problem? So it's all of the courses to basically like let you feel confident and autonomous in dealing with any situation that comes through your door. So a big component is about how do we approach research? How do we read research? And a lot of practicing of that. And then also kind of a case study or clinical application. So there will be opportunities for people to bring in specific case studies, like say, Cheryl, you have a client who has patellar tendinopathy, and you're like, I don't really know what to do. Maybe this is a great client for a case study, right? And you can kind of bring this specific case, this person, anonymously, right, to our sessions, our application sessions, and we can talk about how you would work in a session with that client. There might also be opportunities for, say, like, you want like a team teaching session with this client, and your client, if they are okay with it, can be kind of like a body where we as a group are kind of looking at this client and doing a like live in vivo workshop essentially with this person. So it's just like a case study of how we might approach working with somebody like that. And also I'm willing to do that with a couple of my clients. So there will be opportunities for people to watch my session with a client live and in person, ask questions to the client, ask questions to me, that kind of stuff. And so these are kind of ideas that I've had. And none of this is like super codified yet, but kind of depending on what people respond to, like if that's like yeah, I'd really like that component to be, you know, featured multiple times, then we can definitely do that. Okay, that was kind of me rambling about what the idea behind the course was. The idea behind the course is to get you feeling confident reading research, to be autonomous, and confident problem solving about the body. That's kind of the basis of the course. But let's get a little bit more into like details. So the course, this is going to cover the spine and the upper extremity. And then the second module will cover lower extremity, and we can talk about special populations in there. So like pre and postnatal would be in special populations, maybe like osteoporosis, or, you know, TBD, I guess, what special populations would mean, because we could go in a lot of different directions there. So it just depends on what people value. Course module 1 would start January 30th, so late January, and it would run through April 24th. And there is a 30th
through April what?
April 24th.
Okay.
And that includes a week off for spring break, probably around Easter. And so, yeah, that's the broad overview of the schedule. And then each week there would be 2 live sessions. One would be a lecture about content, and then one would be application of that content. So kind of more the like, okay, now you know the anatomy of the shoulder. Why is this important in a studio setting? Would be the application part. And then there would be an additional not required hour that would be an office hour. That's kind of like you can come with whatever questions you have about the course content, either content that appeared that week or content from previous weeks, anything that you have more questions about that you're like, I'm just not clear on this, right? And we can talk about.
You said that's an optional office hour?
That is an optional office hour. Yep.
Okay.
And so the lecture and the application sessions, those would be required, but not required to attend live. They'll be recorded, and you can watch them on record if like, you know, like we were saying earlier, we're in time zones around the world. Sometimes there's just going to be an inevitable like conflict in time. So those sessions will be recorded. You could watch them on record. And then also the office hour would be recorded. You could watch that too. And then, you know, you can always reach out to me like personally for added help.
Did you say that those 2 office or 2, the live and application, those are 1 hour?
Yeah.
How
Excuse me.
1 hour?
Yeah, okay. Those will be 1 hour.
Okay.
So I'm trying to make this like not the most hugest time commitment, because I know that we're all busy, right? And I know, I know that we can't just dedicate all of our time to doing this. So I'm trying to, I'm trying to make it a reasonable time commitment, not something that will feel overwhelming for people who are working.
Mhm.
And, if we figure out that we don't have enough time or we need more time, then we could potentially add, an office hour or add another session, or like, we can kind of like build what we need as we go if
Mhm.
we realize it's not enough. Because, and I should have said this in the beginning, this is like a beta run, right? This is a, I'm still figuring out how to deliver this. And so it's just
Right.
kind of this like living thing. It's not something that I'm like, oh yeah, I got this in the bag, no problem.
Right. Right.
This is a learning process for me too.
Right. And on you said, so the lecture and applications can be watched on record, but you could also be live as well if you choose. Okay.
Yeah. Like,
Okay.
I would say that, you're going to get the most value out of
Right.
a course if you can be there live,
Live.
because you're
Right.
going to, like get your questions answered. You're going to be able to interact with whatever is happening in, in a more meaningful way, most likely. But
Right.
I mean, also a record, like not a self-paced, but like a recorded, I watch this every week. It's fine too. And that works, especially if that that's your learning style. That, you only get stuff done at 9 p.m. at night or something like that. Like,
Right. Right.
that's a fine way to do it too. And there will be space for like online interaction that's not live, right? So you could like ask a question online to the group and get an answer from me or somebody else, or, there will be that interaction there. So it's not
Okay.
just like totally siloed.
Okay.
Yeah. Good question about that.
And then
Yeah.
what are we looking at as far as like homework hours? I'll just call it that.
Yeah. So there will be a weekly quiz,
Mm-hmm.
and it will be on content that was delivered that week. So it'll be
Okay.
on lecture content and application content. And I don't expect, like, I don't plan on giving out more homework than that. So if you're like keeping up with the content in the course, I'll
Mm-hmm.
pass out, like, I'll email lecture slides and you'll have those. And what I would do is just like take notes during the lectures, take notes during the application sessions. And that should be like, I'm not going to, pull something out of, I don't know, like a paper asking you
Mm-hmm.
specific questions about the paper, unless that was what the quiz was on, was like, read this paper and then do this.
Mm-hmm.
But I don't have any plans necessarily right now to give like extra homework during the week.
Okay. Okay.
At least not on a regular basis. Yeah.
So you're saying basically the 1 hour lecture is, and then that's kind of your homework for the quiz, and that
Right.
and then you have another hour of application from the
Right.
lecture, correct? Yeah.
Yep.
Okay.
Yep.
Okay.
Exactly. So that's 2 hours of committed time a week minimum.
Mm-hmm. Yeah.
And then 1 hour optional for the lecture. And then, like, I would say go over your notes, and if there are certain things in the lecture that you want to explore more, there will be papers that are linked in the lectures. And so you could go in and explore those, communicating with other students, asking questions, that kind of stuff. If you wanted to form like a study group where, you talk to other people in the course, then you could do that. But that's all like optional and dependent on how much you feel like you're getting from just lectures and applications.
Mhm.
And so I would say like, you know, between like 3 to 6 hours a week
Mhm.
is a
Yeah.
good time estimate for what I would say
Mhm.
to spend on content. And like, you know, 6 hours if you really want to get into it and dive into the content and read papers and, you know, maybe like
Mhm.
watch a video on something.
Mhm.
But yeah, it's not going to be over a 6 hour commitment a week, and probably more like
Mhm.
a 4 hour commitment a week.
Mhm. Okay. Okay.
Yeah.
Okay.
Yeah.
Okay. And let's see, what was I gonna ask? I'll try to think of it. I forgot.
No worries.
Brain fart
Um,
again.
yeah, that's okay. It happens. If it's important, it will come back to you.
Yeah.
Um, and so we set the dates. We said it's a beta run. So yeah, what the beta run means is basically it's like a rough draft.
Mhm.
And I'm learning as I go. And that is why it will be, I'm at half price of what I will set it in the future.
Mhm.
So
Mhm.
it's gonna be $100 per week,
Mhm.
or you know, you can break it into $50 per required session.
Mhm.
Um, and that can be paid all at once. It can be paid weekly. It can be paid, you know, like whatever. We can set up whatever payment schedule works for people.
Mhm.
But that'll, you know, it's a 12-week course that brings it to $1,200 total. And like I said, like beta run 50% off price. Like it's
Mhm.
definitely a like we're learning together.
Mhm.
Um, and in that vein, and another reason why I want to set it at a significantly lower price is because I am in the process of getting CEU credits applicable. So I'm applying to the
Mhm.
National Pilates certification and reached out to ACSM to see
Mhm.
what their requirements were for. So those are the two
Right. Okay.
organizations that I'm trying to apply for continuing education credits in or with.
Right. Right. I know that's something um that I didn't like understand with Breathe, and that I mean, always before when I was in the industry, you were required to have certain amount of credits per, well, depending upon the certification, but usually every other year.
Mhm.
Um, and nothing was ever said about that. Um, I mean,
Well, yeah, it's interesting. So this is kind of how this works is like, so if you are not a member of the ACSM, if you're
mhm,
not a member of the National Pilates certification, whatever the other part of that organization is, if you're not a member of the PMA, right? If you're not a member of these larger organizations, there is no requirement to have
mhm,
continuing education, right?
mhm,
As in, like, if you're not a member of the ACSM, it doesn't really matter that you would get ACSM continuing education credits from this
right,
course because they wouldn't apply to you, right? And so Pilates is an unregulated industry. Nobody has to be a part of a larger certifying body. So what Pilates certification or Pilates, they're not even certification courses, right? What Pilates training courses are is they're just basically teaching you the repertoire.
mhm,
They're not certifying you to do anything.
mhm,
And then a
mhm,
certification, so the why, you know, the National Pilates certification, um, group and the PMA exist they are the ones who actually hand out a certification to already trained Pilates instructors, because they have been accredited with the NCAA, I think, or the NAAC. It's like a national certification board that, like, nurses are certified under, and hairstylists and nail technicians, and like all these people who have to have a license to do what they do. The PMA and the NCPT both are accredited with those organizations. So they are able to hand out a certification to all the trained Pilates instructors. But we all know that you can work in this industry and not be certified. Like, it doesn't matter. There's no governing body who's saying like, hey, your certification is up. You need to get this renewed, or else you're not going to be legally able to own a studio or to teach Pilates. Like, that just doesn't exist in our industry. But these organizations are trying to legitimize certification and make it exist. So I don't know.
Are you saying that then to become a member of these, that basically you're paying probably an annual amount to be a member, and then you have a requirement to have CECs to maintain that membership?
Correct.
Is that what I hear you saying? Yeah. Okay.
Yeah. And it's a membership that you pay yearly for, but it's also you have to take a test to be, so it's like, I don't think they call it membership. Maybe the PMA calls it membership, but the NCPT, they call theirs as a certification. So you basically apply to take their certification test. And then, in order to continue to stay certified with them, every 2 years, you have to fulfill a certain number of CEUs. And that's where, like, you would say like, oh yeah, I took the Anatomy of Pilates course, and that was my 16 CEUs that I needed to do for this whole year. And that's the only reason that it would be like, my course having CEU credit anywhere would be applicable for anybody. But it's like, if you aren't certified by the NCPT, or you're not a member of the PMA, or you're not a member of the ACSM, like, CEC credits from those organizations don't actually matter, because you don't need to fulfill anything.
Right. So what in your opinion, because being in that industry for so long and having to keep up with all these different certifications and the CEUs and all of that stuff, where it literally became a joke, like it was just some of it. And that's not to say, because I am a firm believer of continuing education, but so many of these presenters were horrible, just like, and so what is the benefit of being a member? I mean,
that's a great question. Because you're totally right. They kind of, to me, they feel like clubs that you're just paying money to, where it's like, well, what are they giving me in return? Because I've been in this industry for 15 years teaching Pilates, and nobody has ever once asked to see my training certificate or asked me if I'm certified by the PMA or NCPT. But there are, I think it just depends on where you work.
Sure.
Or where you want to work. Like, I have no idea what Club Pilates requires. Like, I know that they want you to have their Club Pilates certification or their Club Pilates, teaching certificate. But I don't know if they require then on top of that, like, oh yeah, you also need to be NCPT certified or PMA certified. And I don't know how different that is around the world either, right? Like,
Yeah. Yeah.
I don't know what it's like in Australia, but I feel like it's similar. I don't know what it's like in Europe,
Mhm.
but I feel like it's similar. Like the bigger studios that are more corporate, maybe like a Club
Right.
Pilates or franchise
Mhm.
studios, they might have different requirements around the world. Um, but like I said, you know, unless you are like, oh yeah, I'm certified by this agency and I do need to fulfill CEUs every year, you know, then that would be something that like you all could put to me saying like, hey, can you look at trying to get CEU accredited for this organization? And I can look into that.
Right. Right.
Yeah, but otherwise it's kind of just like, you know, I might do the NCPT because a lot of people are choosing to be certified now through them, which is
Right.
fine. And so that might be advantageous.
Right.
Somebody had asked about going through the Australian qualification system, or ASQA, which is something that Breathe did for their diploma. They are, and I think they also do for their the comprehensive training.
Mm.
I also know that they are potentially dropping that. I don't know
Oh,
right now what they're
yeah.
thinking, but when I was working there, it was
Yeah.
a very cumbersome bureaucratic system
Yeah. Mhm.
to go by the requirements that the government set for
Mhm.
people who were teaching fitness in the Pilates industry.
Mhm.
Um, and I also know that at the point that Breathe implemented that years ago, for the diploma of clinical Pilates, it had a lot of relevance because you would receive a healthcare provider number, which would allow people to claim that on their healthcare or like go see you for free. Essentially, I might be like misstating that
Oh.
significantly, but it qualified
Mhm.
you in a way that you were covered kind of as a, you know, government healthcare provider
Sure. Yeah.
in a
Yeah.
way that like physios are.
Right.
But
Right.
that is not something that is the case anymore in Australia. So, you know, say right now you go through a diploma of clinical Pilates anywhere in Australia, it doesn't have to be with Breathe, right? It doesn't give you any sort of special advantage other than that it's kind of
Mhm.
like going to grad school after you got your
Right.
bachelor's or something like that, right? It's just giving you more knowledge, but it's not
Right.
providing any specific clinical um uh what's the word I'm looking for? Any sort of specific clinical designation, I guess. Like the
Mhm.
word
Mhm.
clinical Pilates instructor, um we could just say Pilates instructor. The clinical part is like it
Yeah.
is not, it's not very meaningful. Um, especially in the US, like clinical Pilates doesn't mean anything more than just being a Pilates instructor. Like we don't really use that word clinical Pilates here. Um, and so this program would be a little bit more just like, okay, this is like continuing education. This is not,
Yeah.
you're not going to get a diploma. You'll get a certificate that says I completed this
Yeah.
course. And if there are
Yeah.
CEUs attached to it, that will be listed. But it's more just like this is continuing education for your own personal
Absolutely.
enrichment. Yeah.
Right.
And professionally, you know, if you are a comprehensively trained Pilates instructor, professionally, the Pilates industry sees you as able to teach private clients, able to teach group classes, able to teach people with injuries and pathologies.
Mhm.
Um, and also, like I said, I have worked in many studios, but none of them have been franchise studios. None of them have been kind of like these bigger operations. And so I don't know
Right.
what the requirements there are.
Right.
And just keeping in mind that like every studio is going to have their own kind of set of parameters for who can teach private sessions, who can teach people with injuries and pathologies. if you take this course, it's not a guarantee that the studio you go work at is going to say like, oh yeah, no problem, you can teach people with injuries or pathologies.
Right.
But, you know, it's like, if you have a comprehensive training certification, you're qualified to teach people with injuries and pathologies under, you know, kind of like the general guidelines.
Right.
But every studio is different. So that's just like a thing that like you'd really have to inquire with the studio that you teach at to say like, hey, I'm going to take this continuing education course. Is this going to be meaningful for my advancement in this specific studio?
Right.
Yeah.
Are you going to be, so you know how you had said that we may bring in like case studies, somebody's existing client for whatever. Would any of that be for, like I know you work with rehab clients. Would you bring in a rehab client? Would what we're learning be applicable to work with rehab clients? That's what I want to, okay.
Absolutely.
That was the impression that I had originally when you put this out, and something that I definitely, okay. So,
Yep. So the whole course is designed to get you more comfortable teaching people who are in rehab. And we're talking about rehab in a setting of subacute rehab, which just means they've seen their physical therapist. So let's say like somebody has one of your clients who you've seen for years, all of a sudden starts getting like a ton of knee pain. So you're going to be able to, after you take this course or while you're taking the course, be able to clinically reason their knee pain, to be able to give them exercises that either strengthen their knee, follow clinical guidelines, because you will understand how to go look up clinical guidelines if there are clinical guidelines, and then how to apply those clinical guidelines. And then say you did all the right things and your client still chose to get surgery, or they had to have surgery for some reason, which happens. And then you'll be able to work with that client after they come back from knee surgery and they've been discharged from physical therapy. So you'll understand the rehab process from pre-surgery to post-surgery, or even how to address somebody who's pre-surgery, give them exercises according to clinical guidelines if there are, and help keep them out of surgery, right? So those are like the common scenarios. Learn how to work with people who are experiencing back pain, learn about the biopsychosocial aspects of pain, specifically lower back pain. And then, dive into some very specific, like, what do we do with somebody who has patellar tendinopathy? What do we do with somebody who has, rotator cuff tears, that kind of stuff.
Okay. But not like somebody who's paraplegic or anything like that. That would be
no, that would be
probably.
I am planning on doing working with adaptive athletes course. But that would be offered as probably a short form course. And something
what do you mean, a short form course? Just a shorter,
just like a few weekends, or something that you could do kind of online, self-paced. But we would probably not include any of the adaptive stuff. But that, I mean, if that's something that people do really want to like touch on, we can definitely touch on some stuff. We probably just wouldn't be able to go super deep into it along with all of the other stuff.
Okay.
Yeah, good question. What else? So we kind of talked about the weekly schedule, clinical observation. So 12 weeks brings us to the end of April. During the summer, we would take a break. And then in September, we would come back for module 2, which, you can not take module 2 if you don't want to. You could join at module 2. Like, these are meant to be kind of, standalone, or altogether. They would cover the whole
I
body.
see.
Yeah.
Oh, I see.
And
Okay, so this is mainly the spine and lower extremity.
spine and
that true?
upper extremity.
Spine and upper. Okay.
Yep, exactly. So it would cover, like core musculature, spinal anatomy, arms and shoulders, head and neck, that kind of stuff. And then lower extremity would be just the lower extremity plus special populations. So that's where like pre and
But all
postnatal
that
would
is
live.
is all that in module 1, you're saying?
No. So module
Okay,
1.
Module 1 is spine and upper extremity.
Yep, 12 weeks of spine and upper extremity.
Okay.
And then we would
the
take a break over summer.
Okay.
Yeah.
Lower extremity and special population is module 2.
Correct.
Ah, okay.
Yeah.
Got it.
Yep.
Okay.
And that would be a separate 12-week session, which would start in September.
I see. Okay.
Yeah. And so in that break, that summer break, what I envision happening is that to gain more clinical experience working with rehab clients, you all would potentially have the opportunity to do clinical observation at a physical therapy clinic or physio clinic in your area, which is twofold. Like, I see value in it in 2 ways. One, that it keeps you involved in a kind of, real world, like, so we studied all of this in the research, but what actually happens in the real world? Because those two things can be really different from each other, where we go from research, which is, kind of like this clinical, not real world setting necessarily, and we try to apply it to real world people, and it can look really different from those two things. So I think that clinical observation can be really valuable, and it can also help connect you with people in your area, other healthcare professionals in your area, to start to create a network, right? Because these are the people, these are the physical therapists and physios who are going to refer their clients, their patients to you after they discharge them from physical therapy. So part of working with rehab clients, and really just like working with any client, right, is developing a network of healthcare professionals where you all refer to each other, right? Because there is a lot that is out of our scope of practice. And we'll go over what is and what is not our scope of practice when we're talking about rehab. So, like, I'm always referring people out, and I have like a good referral network area where those clinicians refer back to me. And so starting to reach out and develop those relationships, I think, is a really excellent thing to do. And it just helps you, like, the more you can see the way that different people work with the same pathology, the better, right? Like, you see somebody work with a knee replacement one way with one person, and then you see somebody work with a knee replacement a totally different way with a different person. And then you get to ask them, like, oh, okay, you did this over here. Like, why did you do it differently over here? Right? Those are the real, like, valuable moments. And so this is what I envision happening, like, over the summer, or, you can do it for a month, you can do it for a week, you can do it for, like, you can do it for however long you want. It's not a requirement. But I do think that it adds a ton of value to your learning experience if that is available to you.
How receptive, I don't know, how receptive are PTs in taking on people for observation like that? Do you know?
Well, it's a requirement for applications for PT school.
Right.
So if you're a person who's not in physical therapy school, but you're just thinking about going, this is what I did. I called clinics or in my area and I was like, hey, this is who I am. This is what I'm trying to do. Would you be open to me coming in and observing some sessions with you or another clinician? And almost everybody, like, I think it's just such a common practice that most people are very, very open to it.
Okay.
And you could, I would just say like, hey, I'm a Pilates instructor. Like, you say I'm super interested in rehab. Like, maybe I'm thinking about going to PT school, or, like, you can say whatever you want. But I do think that it's so common that I don't think anybody would not want you there.
Okay.
Yeah, totally. That was my experience, at least, I should say.
Okay.
And there's like all kinds of different physical therapy facilities that you could observe at. And I would really stick to physical therapy or physio, mostly because, they are really going to be the ones who are working within kind of clinical guidelines, where not that chiropractors or other healthcare professionals don't, but it's just not as, physical therapists are diagnosing people, they're recommending, surgery or not surgery. They're doing things that are a little bit more hands-on. And so those are the clinics that I would suggest reaching out to if that's something that appeals to you.
Okay.
And
so on
go
the
ahead.
module 2, when you start a new 12-week, so then that, what's that looking like cost-wise?
The same. It would still be like the beta run. Yeah, the first run of module 1 and 2 would both be $1,200 per module. And it would follow the same format, unless, we observed things in the first module that were like, oh yeah, this, we have to like put another office hour here, or we should do this instead of the office hour, whatever. We can make changes there, but the price won't change. It will stay the same for modules 1 and 2.
Okay.
Yep. Yeah.
Okay. And so that is that, are you doing a module 3 as well, or just the 2 modules you're saying?
Probably just the 2 modules. That's what I'm thinking for right now, just because, it's meant to, that covers the whole body as far as anatomy goes. And then, I might run some kind of like I was saying, shorter courses that are either like a self-paced thing that people could do that are more specific about specific populations. But I think that we can cover a lot in 2 12-week modules.
Okay.
Yeah. What else? I have 3 guest presenters that I'm approaching about doing a lecture in their specialty. One is a sleep researcher who's a friend of mine, and so she is like doing a ton of clinical trials on sleep, and she has a lot of really interesting things to say on how sleep affects our ability to heal and our experience of pain and that kind of stuff. So that's kind of like in the biopsychosocial realm of rehab, or biopsychosocial realm of pain, which is a big component of how we approach rehab clients. Is that biopsychosocial. So there would be like a couple lectures that people would need to watch beforehand, before the course starts. One of those would be about what the biopsychosocial model is. Because that could be its own module. That could be its own like part. You know
yeah,
what I mean? Like there's there's a
yeah,
lot in there, but I think
yeah.
that we could kind of cover the basics in like an hour lecture that would be recorded and you could watch it on your own. And then there would be a couple more kind of short videos that just explain like, what do we mean by rehab? Like, what's our definition of rehab? Like, you know, just kind of some stuff that we would want to address before we start the meat of the course.
How long will we have access to the recorded sessions?
For as long as you want. So I would say for the entire year. So say that you were taking module 1 and you didn't know if you're going to take module 2, but maybe you were thinking about it, or maybe you were like, I don't think I'm going to take module 2, but I just wanted to take module 1. You'd still have access to course materials through the whole year.
Okay.
And then, so for 24 months, basically, or sorry, 12 months, you would have access to course materials. Yep. And then, you know, if you decided to start at module 2, you would have access to course materials from the start date of your module.
Right. Okay.
Yeah. For the year.
Right.
All the way through.
Right. Okay.
And then, so I run weekly classes and I have a video library and on-demand library. And people who are in the course would have access to those things for free. You would, if you wanted to do the first module and you know that you want to do the second module, throughout the summer, through that little break, you would continue to have access to the video library and have access to classes. So you could continue to take those. Yep.
Okay. Yeah.
Yeah.
Okay. That's cool. Oh shoot, I just had another brain fart. Let's see. Okay. Well, I'll think of it. It'll come to me.
Yeah.
I'm not sure when.
There was another guest lecturer who I was going to bring in, who's a pelvic health physical therapist. She's super awesome. And I think, you know, like, yeah, I think that we could talk about pelvic health because we are, you know, that's part of our spine and upper extremity and core, but it's also part of our lower extremity. So we'll just see what her availability is, I guess, to see if she's in module 1 or 2, or maybe she's going to be in both.
Yeah.
And then I had one more guest instructor who is a researcher at, I think she specializes in researching obstetrics and gynecology and how Black women are affected by higher maternal death rates and kind of just the medical system. And so I wanted to bring her in to talk about the difficulty in like where research misses the mark, the populations that research leaves out, like all of these kind of critical thinking questions about like research doesn't capture everything. And, you know, we are, because we're humans, we're inherently biased, and why we should still continue to read the research and rely on it. So I think she does a really nice job of addressing like where it misses and why we can't just throw it out the window either.
Yeah. Okay.
Yeah. So I think that covers like all the questions that I got in the email. It covers everything that I had on my little piece of paper.
Okay. Yeah. It sounds amazing.
Yeah, I'm excited. This is definitely where I get really hyped on this kind of problem solving aspect of teaching Pilates. Like I love, you know, just making people sweat. But I also, you know, I think every single one of us, regardless of what type of Pilates we teach or where we teach, like we're going to have people that come in sometimes and they're going to be like, oh, my back hurts, or, my
For
knee
sure.
hurts. And, how do we address those people?
Yeah.
How do we also give individual clients meaningful movement towards their goals? How do we get them to meet their goals? Like all of these things, I get super excited about, because that's like the
Yeah.
fun part of teaching Pilates. And then like, just kind of, it's like a puzzle, like problem solving with your client,
Yeah. Yeah.
Yeah.
Yeah.
So
Very cool.
this is the stuff that gets me super fired up, and why I'm
Yeah.
still doing this after 15 years.
Well, you're good at it too. So
Oh, thanks.
yeah. And it's been fun to watch you grow.
Yeah. Oh, thanks, Cheryl.
Yeah. Yeah.
It's really sweet.
Yeah. Amazing. I love it. It's super fun and inspiring too. So,
yeah.
yeah.
It's so fun to have you like be here in this fellow teacher role also. Like to have you be a
which
colleague.
I never, I mean, it's like, it was the last thing that I thought, I mean, once I retired out, I was like, I'm done. Like,
You're such a natural though. You're such a natural.
Well, it was really just what Pilates has done for me all the way around, so and I've just been forever thankful for both you and Summer. And then to meet Anula, was like, wow, this is it's been, I felt like I kind of had a really good core group of teachers that were really, really good. And I mean, I had been around Pilates instructors for several years, but it was like I just couldn't, I didn't have the connection. There was definitely something missing. And I think a lot of it too was the rigidity of it, but,
right.
Yeah,
totally.
But, yeah. So yeah, I feel really blessed. Yeah. So, okay, so what is your what's your next step then? So you are going to wait when people obviously watch this and respond, and then
so in my brain I'm thinking of opening registration at the beginning of, well, maybe I don't know, either opening registration at the beginning of December or opening it at like mid-December, and then closing it January 1st or somewhere around there. Or maybe opening it January 1st and closing it the 15th. I don't know. Like with the holidays, it's always a little bit funky. And I know people feel super overwhelmed. Yeah, totally. So I can I'll ask for feedback, I guess, on through email. But the next step would be just like opening registration and kind of seeing what the interest is for this round. And I mean, I honestly don't really have any like minimum. Like I'll do it if it's just one person, because I'm super stoked on it. I think it's awesome. I would like to develop this course anyway. So,
and you got to start somewhere.
Right. Exactly. Totally. Like that's exactly how I feel. Like I have to start somewhere, or it has to start somewhere. And like, I am more than happy to do it. If it's just like, there's one person that's interested, that's fine for me. Like I'll be here.
Okay. Well, and that's good to know. Yeah.
Right. Yeah. It would be like the ultimate, private experience.
Yeah. No kidding. Yeah. Yeah. Well, and that is, I mean, no, that's cool. I kind of feel that way, just like as a new instructor going into this modality of, it's like, well, I haven't done any marketing. I haven't done anything. Like, I don't even
Right.
know what I'm going to really do. Like,
Yeah.
I know I want to help people, and I know I don't want to work at any big gym. I know I don't want to, I know things I don't want to do, and I know some things that I do want to do, but yeah, you don't
Yeah.
know until you start, I guess. And that's
Totally.
yeah,
Yeah. It takes
a
a little
little bit.
while sometimes to find your groove, like where
Yeah,
you feel like you fit in best. Right.
yeah, yeah.
Yeah.
So I'm kind of just, I just kind of put feelers out here and there, and then I'll just see where that leads me. Cause I also still want to enjoy retirement, and I don't want to work full time.
Right. Totally.
Am I
Yes,
asking too
please.
much?
No,
Come on.
definitely not. You're definitely not asking too much. I think this is the
So,
perfect profession to be able to kind of straddle that line too, you know?
yeah,
Especially
well,
with
I'm
like
hoping.
things moving digitally where it's like, you can maybe just tell your clients, hey, you want to keep working with me? Like, I'm going to be over here. We can do it online if you want.
Totally.
Yeah.
Although I will say that the groups that the people I've been working with over the summer or since our sessions were probably 3 out of the, well, more than that, 1, 2, 3, 4, probably 4 out of the 7 that I worked with are like, no, I'm not doing Zoom. Like, no. And it's like,
Oh,
okay,
yeah. Yeah,
that's fine.
totally.
But they're older too.
Right.
They're intimidated by it. They're,
Yeah.
this, that, and the other. So
Right.
that's fine.
Everybody has their, their like, yeah, I know some people who like Summer she hates Zoom. She is like,
Does she?
she does. Oh yeah. She like is not like, I don't think she's teaching it on Zoom at all anymore. She just did
Well,
not like it.
I mean, she does the apparatus on Zoom from home. Like, you can
Does
join
she?
in on, yes, because
Oh,
I've
right.
joined
Like you
in
could,
on her. Yeah. I don't know about her others.
yeah. I think she's teaching, she'll teach live in person and then have people also be able to call in, right? Yeah. Yeah.
Right. Right. I don't
Yeah.
know what
That's
she's
cool.
doing
That's good for her.
otherwise than that. But
Yeah.
yeah, and it is funny because she is kind of old school.
Yeah, totally. She likes going to the studio, like she likes not being in her
Yeah.
house and stuff. Yeah, totally. Like,
Yeah.
and that fully works for her. Yeah, everybody's
Right.
finding their
Exactly.
way to be in the industry now.
Yeah. Yeah.
Yeah.
All right, my dear. Well, I will
Great,
let you
dear.
go if you have if you're done, and then
Yeah.
I'll just wait to hear from you.
Okay, cool. Sounds good.
Sounds good.
Yeah, feel free to shoot me any questions in the meantime, or get in
Okay.
touch with me if you need to.
Okay. Sounds good.
All right, hun. Thank
Thanks,
you.
Cody. Okay.
Bye.
Talk soon.